My name is Brianna and I'm from the education team. I'm a digital health educator here at the agency. And it's my great pleasure to also introduce my colleague, Jade Kennedy, who is the Senior Compliance Officer here at the agency and will also be providing some really useful, hopefully useful information to you all about the policies and participation obligations around My Health Record and give you all the information that you may be after around how to appropriately implement My Health Record and some of these digital health tools into your practices. So what I might do before we jump into it is just remind you, I'm sure you're all familiar with Teams, but please use the chat to pop any questions in or comments that you have as we move through the content today. While we've got Jade and on the line, it might be a great opportunity to ask any sort of policy related questions that you may have for Jade while we've got her expertise with us. So please pop them through and we will go through those at the end of the session. So Jade, if we can go to the next slide, I'd also like to kick off with an acknowledgement, acknowledging the traditional owners of country throughout Australia and their continuing connection to land, sea and community, paying our respects to them and their cultures and to elders past, present and emerging. And I'd like to acknowledge and extend that respect to any Aboriginal or Torres Strait Islander colleagues who may be joining us on the line today. So in regards to the agenda today, there is quite a bit of content to get through. We have had the question already if the session will be recorded. It absolutely will be recorded. So I'm sure the team at the PHN will disseminate that as well as the slides. So if there's any links or useful resources as we move through the session that you'd like to revisit, you should also have access to that as well. Now we're going to cover the legislative frameworks that relate to the My Health Record system, an overview of the compliance requirements for any organisation that would like to use the system. We're going to highlight how we can establish and maintain a security and access policy within our organisations, and particularly highlighting the OAIC guidance and template that is available. Ongoing participation obligations and additional requirements for using the system. And then we're going to touch on some other considerations around how this might apply to some other digital health tools that you may be using in your organisations, and some time for Q&A at the end as well. So I'll hand over now to Jade Kennedy, who's going to take us through an overview of the legislation. Thanks, Jade.
Thanks, Brianna. Just before I do get started, just to let you know, as I'm sharing, I can't actually see the chat. So if anyone does have any questions, as Brianna said, just feel free to jump in or maybe raise your hand and Brianna can let me know that someone has a question. So I wanted to kick off by giving you a bit of an overview of the legislation that underpins the My Health Record system. So there's a few different pieces of legislation that are relevant, which are listed on this slide. So there's the Privacy Act 1988, My Health Records Act, My Health Records Regulation, My Health Records Rule, and the Healthcare Identifiers Act 2010. And this legislation really protects and governs the way that the data within the My Health Record system is managed. Just to point out, most of the requirements that I'll talk about today come from the My Health Records Act 2012 and the My Health Records Rule 2016. So there are a range of obligations for healthcare provider organisations that want to participate in the My Health Record system. Some of these arise prior to registering for My Health Record, and others arise once the organisation has already registered. So there's an overview provided on this screen. As you can see, some of the key ones to point out and that we'll be looking at today are the requirement to develop a My Health Record security and access policy, which arises prior to registration. And then once registered, obviously staff training requirements, things like complying with any data breach reporting requirements, responding to any requests for assistance made by the system operator, which is currently the agency, and then some other sort of ongoing administrative requirements that organisations need to be aware of as well, particularly notifying the system operator of any changes to the organisation's registration, and ensuring that the organisation's responsible officer and organisation maintenance officer details are kept up to date in HPOS. So as I said, today we'll be focusing on a few of the obligations that are listed on this slide, particularly some of those more important ones that I just highlighted. So if we start with security and access policies, the requirement to have a security and access policy in place at the organisation stems from Rule 42 of the My Health Records Rule 2016. Which states that any organisation that wants to register with the My Health Record system needs to establish, communicate and enforce a written policy that covers a range of prescribed topics. And these prescribed topics are what you can see listed on this slide. So it needs to cover how people are authorised to access the My Health Record system, including suspending or deactivating access in certain circumstances, for example, when a person leaves the organisation or if they have their account compromised. It also needs to cover the training that's provided to employees before they access the system for the first time. And this training needs to cover how to use the system accurately and responsibly, the legal obligations on that person and on the organisation accessing the My Health Record system, and the consequences of breaching those legal obligations. And the policy also needs to cover the process for identifying a person. So, for example, how the organisation's clinical information software records unique identifiers and things like that. The physical and information security measures taken by the organisation. So an example of physical security measures that might be in place is, the use of privacy screens or having areas where the My Health Record system is accessed under video surveillance. IT security measures might be the use of passwords, the requirement to change passwords on a regular basis, things like that. Also mitigation strategies to promptly identify, act upon and report security risks. And if applicable, so if the organisation is providing assisted registration, which is where they help an individual to register, to set up a My Health Record, then they also need to provide some information on assisted registration processes, such as obtaining consumer consent and things like that. So as I said, it's important that this is in place prior to registration. Something to point out is that under the current registration process, organisations are actually required to declare that they do have this policy in place as they're registering. And one other thing to point out with regards to these themes that need to be covered, it is possible under the My Health Records Rule 2016 to not cover any of these topics if the organisation considers that the topic doesn't apply due to the size of the organisation. So, for example, as I mentioned, assisted registration, not all organisations are providing that. We do suggest, though, that if this is the case, if the organisation has decided not to cover any of these topics due to their size, that this is actually specified in the policy. Something like, this assisted registration is not covered in this policy because this is not carried out by the organisation, or this theme doesn't apply due to the limited size of our organisation. So there's a number of resources to assist organisations in developing a security and access policy. The first that you can see listed on this slide is a fairly new template developed by the Office of the Australian Information Commissioner in collaboration with the agency, which is a template that can be used by organisations when they are setting up their policies. So I do just want to show you the template quickly. I'll just have to change my share if you give me 1 second, sorry. Hopefully you can all see that. Is that okay, Brianna?
Yeah, that's looking good, Jade.
Perfect. So I'll just take you through very quickly so that you can see what the policy looks like. This was developed, this was released last year. So at the beginning, there's a fairly comprehensive overview of requirements and things like that. A few of the things I've just mentioned, for example, not covering a particular topic, is spelled out at the beginning. Then there's a section on key information to be filled out, for example, the responsible officer and the OMO details, things like the date of last review and date of next review. One of the requirements with the security and access policy is that it needs to be reviewed annually at a minimum, as well as whenever any new new risks are identified for the organisation. There's a place to link other relevant documents, and then it takes you through basically topic by topic, and the organisation simply has to fill out their name, and then there's also a free text field where they outline the processes that they have in place, for example, for authorising individuals or training that's provided. That's in the next section. In some cases, you'll see that there has been a drop-down list added to make things a little bit easier for the organisation. And there's also some optional sections that can be filled out, for example, specific training details or links to training that's provided, things like that. One of the main goals with this policy template was to make things easier for the healthcare organisation when they are preparing their security and access policy, but also making sure that the template allows organisations to really adapt the policy to their organisation. Prior to this template being released, there were some other templates available that were a lot more prescriptive, and we did find that organisations weren't necessarily adapting the policy template to their organisation. So that's really the aim here. There are some examples provided to help organisations. As I said, we did want to make things easy for people, but the idea is really that organisations will have a think about it, think about what processes they have in place, what their risks are, and then really tailor the policy as much as they can. There's a couple of additional optional sections, for example, concerning remote access. There's also one to do with patient complaints. Optional sections, as the name implies, are clearly optional and could be removed from the template if they don't apply. So I will just stop sharing that and go back to the main slides unless anybody has any questions on that policy template before I move on. So we'll go back to the slides.
We haven't got any hands up or questions in the chat, Jade, so I think we're good to move on. But again, yeah, just to call out, if anyone's got questions, feel free to pop them in or pop your hand up.
Perfect. So in addition to the policy template, there's a couple of other resources that are quite useful for organisations as well. So one of these, and the link is provided here, is listed on the agency website. It's a security and access policy checklist, which healthcare provider organisations can download and go through and basically tick off to make sure that their policy covers everything that it needs to cover under the legislation. There's also an e-learning module that was developed by the agency last year that's called Developing a Security and Access Policy for Your Organisation, and it basically takes you through the OAIC template step by step, focusing on each section separately, and is a sort of step-by-step guide to filling in the template and really developing an effective policy for your organisation. One thing I wanted to mention before moving on from security and access policies is that the OAIC has carried out assessments in the past in relation to security and access policies, and may carry out similar assessments in the future. So last year, for example, the OAIC looked at the security and access policies of a randomly selected group of GP practices. And as I said, I mean, no information at this point in time, but could very easily carry out similar assessments in the future with regard to other cohorts. In addition to these assessments that are carried out by the OAIC, the agency also conducts regular what we call quality assurance exercises, which is where we take a randomly selected sample of healthcare providers, usually from a specific cohort, but not necessarily, and sends a letter to the selected organisations asking them to submit a copy of their policy to the agency that we then review, and we provide feedback to the organisation, if they've missed topics or things like that, if they haven't carried out their review, so that they can make sure that they're really complying with these legislative obligations that they have. We conduct those quality assurance assessments regularly, usually, about once or twice a year. So, and that is an ongoing activity that we are doing. So I'll just hand back to Brianna now to talk to you about staff training.
Thanks so much, Jade. And in regards to staff training, there is a lot of useful resources. Now, we know that My Health Record is a system that many of us sort of registered for or started using maybe some years ago, and the system does sort of develop and become enhanced, and sort of things kind of change as time goes on. So it is important to be aware of the resources that are available to you and the things that can support you with providing training to the staff within your organisation, not only initially when they join your organisation or when you first start using My Health Record, but also on an ongoing basis. So as Jade mentioned, in the My Health Record policy, there is a section on training that must be completed. So your organisation must have a process for offering and recording training for staff within your organisation. And you can see here that this list kind of covers what the minimum requirements for the training. So the training needs to cover how to use the My Health Record system accurately and responsibly. It also needs to cover the legal obligations for using the system and also the consequences for breaching those obligations. Now, this is the minimum requirement, but we do also encourage that practices ensure that training covers other parts of using the system in addition to these, minimum requirements. So things like how to appropriately implement My Health Record in day-to-day workflows, the clinical benefits of accessing My Health Record, how to appropriately view and upload documents, patient side of using the system, privacy and security of the system. There's a great deal of topics involved in using My Health Record as a healthcare provider, and things that can really support clinicians in how to understand the system, but also how to use it most appropriately and in the best way for their patients. So certainly there are a deal of training opportunities available. There are a few links on the bottom of the slide here. Again, the slides will be shared with everyone, so you can certainly follow these links, but there is live webinars and events that are run on a regular basis. We run short and sharp sessions, so 30-minute sessions for particular cohorts or topics. So, for example, there's aged care. If for example, you have GPs or you are a GP that works in aged care and you're interested in My Health Record in that space, we've got a specific session on designing and developing your policy if you're a practice manager. We've got sessions on understanding the medicines side of the My Health Record, so how to access and view medicines. There's also information for, specifically for nurses, and so on. So there's a great deal of useful these are just a few examples that I've just pulled out just to kind of demonstrate the scope of sessions that I think might be useful to many of you on the line, but certainly there's a great deal of other sessions that are available. We also, in addition to the live sessions, have e-learning modules. So this might be something that you might find useful to incorporate into your training plan for staff, particularly if you have staff from a range of disciplines. So we have e-learning modules designed specifically for nurses, for GPs, for pharmacists, for allied health providers, and so on. So if you would like to have a look or investigate what e-learning modules are currently available and the different topics, you can certainly have a look there as well. And we do have sort of pre-recorded webinars and webinar series. So this should hopefully help you to understand the resources that are available to you and decide what is most appropriate for your organisation. Training is going to look different for every organisation depending on the needs of your specific practice and your staff. There is also no prescriptive time frame around when training needs to reoccur. So again, that comes back to the practice to discuss and determine when training should be refreshed. So all of that to say that you must have a way of showing evidence of the training that was provided initially and also on an ongoing basis. So again, it's up to you how you collect that evidence, how you sort of maintain a register or a list of the staff members in your practice that have been trained and what training they received, and, you know, having dates and sign off. I'm sure many of you have templates. If you've gone through the accreditation process or you're going through it at the moment, I'm sure you're very familiar with, you know, a range of sort of templates and resources that probably sound pretty similar to what I've just described, but you can sort of come up with whatever template or system works best for you and your practice to be able to maintain a register of your staff training. If we go to the next slide, Jade, you'll see that the agency has put together a training checklist. So this might be something, you know, something that you use. Again, you don't have to use this. It's up to your practice to determine whether this is, you know, going to work for you. But here is just one resource to help you get started. And this, again, has a great deal of clickable links in there that you can download and, you know, send or share to people in your practice, and that will direct them to learning materials. It's also got a checklist of topics, so things that can be covered, or to ensure that the individual user of the system can tick off all of the different topics to basically declare that they understand or they have received sufficient training for each of those topic areas. They can then sort of sign that training checklist and then send it back to the, you know, practice managers or the RO or OMO of the organisation who's taking care or maintaining the training register for the organisation when it comes to My Health Record training. So again, this is just one example, but it's up to the practice how they implement My Health Record training for their staff and how they manage that on an ongoing basis. Now, another note here is that if we've got any sort of pharmacists on the line, this is part of the pharmacy accreditation. So I believe it is item 5.10.1 in the accreditation, where you need to be able to show that My Health Record training is being provided to the staff within the pharmacy as well. So this is not only for RACGP accreditation, but also for other accreditation bodies such as pharmacy and other sectors as well. So just thought we'd point that out there as well. So I might hand back to you, Jade, for the next parts on the policy or the legislative requirements around ongoing participation obligations.
Yeah, thanks, Brianna. So as we saw on that slide that I showed you at the beginning, in addition to the obligations that exist prior to registering with My Health Record system, there's also a number of obligations that arise once an organisation has registered, and which are ongoing, you know, as long as they're registered with the My Health Record system. So this is these match those obligations that were shown on that first slide. Obviously, I've covered, you know, the requirements around the security and access policy, as I mentioned earlier. This needs to be reviewed at least annually, but also every time any new risks are identified for the organisation. Brianna has covered some things on staff training. There's also requirements to have a process in place to prevent information being uploaded to My Health Record where a consumer has specifically said that they don't want that information uploaded to My Health Record. There's a requirement to ensure that information uploaded to My Health Record is easily understood, accurate, up to date, and has been prepared by a registered healthcare provider. A requirement to ensure that data quality is maintained, a requirement to respond to any request for assistance made by the system operator. So, for example, if your organisation was contacted in the context of one of the quality assurance exercises that I mentioned, then there is actually a legal requirement to respond to that request from the system operator. The other requirements concern, and this is quite an important one I mentioned earlier, the data breach notification requirements, or the requirement to notify any non-clinical My Health Record system related errors, particularly with regards to data breach notification requirements. So these requirements are set out in Section 75 of the My Health Records Act. And basically, organisations need to ensure that they notify the agency as system operator of any data breach involving the My Health Record system. If the organisation is a private organisation, then they would also need to notify the Office of the Australian Information Commissioner. Public organisations are only required to notify the agency. There are penalties for failing to notify the agency of a data breach. So that's a really important one to be aware of. In addition to those ongoing requirements, there's also a couple of other requirements that I wanted to bring to your attention. The first is ensuring that the agency is notified within 14 days of any changes to registration, particularly if you cease to be eligible for registration with My Health Record system. This is obviously something that is quite common. An organisation might be closing their business or has ceased trading. If they no longer employ a healthcare provider individual that has a healthcare provider identifier, or if the organisation no longer has a HPIO for their organisation, then they need to notify the system operator within 14 days so that they can be deregistered from the My Health Record system. The other requirement to be aware of is just ensuring that details for the organisation's responsible officer and organisation maintenance officer are kept up to date in HBOS. So the RO, I won't go into too much detail on this, but the RO and the OMO are basically people that have been identified by the organisation when they're registering as the people who will deal with the organisation's dealings in terms of My Health Record, will communicate with the system operator and things like that. So it's really important that their contact details are kept up to date in HBOS so that any communication that needs to be sent to the organisation by the agency can be sent. We often see that people obviously change roles, they move to different organisations, and in that change the details are not necessarily updated, so it can make communication with organisations somewhat challenging. So I will now hand back to you, Brianna, to cover the remaining additional considerations.
Thanks so much, Jade. And I might put a call out now as well for anybody who's got any questions around the My Health Record policy, what your obligations are for using the policy, anything to do with implementing My Health Record like appropriately. Please use the opportunity now to ask any questions. There's no silly questions. We're absolutely here to help you today, and hopefully you can go away from the session today feeling confident with what you need to do and what you need to know for implementing My Health Record, appropriately when it comes to, policies and using the system correctly. So don't hesitate to ask any questions. While you think about your questions that you may have, or, pop them in the chat or pop your hand up, I'll move on to some additional considerations or things to think about in addition to ensuring that you've got the policy in place and that you are, complying with those obligations that Jade mentioned. And one of the obligations, and this is sort of an FAQ that we get quite often, and something that we thought we'd call out today, is when it comes to appropriately using the system by various people in your organisation. So the first thing that we'll highlight is authority to view. Now, this is stipulated in the legislation that Jade talked about when it comes to who in the organisation is allowed to use My Health Record and when it is appropriate, like in instance when My Health Record use is appropriate versus when My Health Record use is not appropriate. And so this all comes down to the authority to view. Now, authority to view is basically defined in two ways. So the first part of the equation is that the provider is authorised to access My Health Record as long as they have been authorised to use the system by their organisation. So Jade mentioned that every organisation should have an RO and an OMO, and I'm sure many of you are familiar with those acronyms, but let us know if you're not. The RO being the responsible officer and the OMO being an organisation maintenance officer, and these are the people that are managing My Health Record use within the organisation. So typically practice manager would be an OMO, for example. Now, the organisation needs to authorise use for individual staff members. So that might involve a process where you must complete training in order to be authorised. There may be, additional requirements that as an organisation you decide to set before a person is given authority or access to My Health Record. That could be a clinical or a non-clinical person. So again, this comes down to the process that the organisation has put in place. As long as it complies with the legislation, they can decide on user access. And then again, goes back to the policy. There are some great examples in the policy that Jade has highlighted around what authorizing user access might look like. And I recommend having a look at some of those examples in the policy template if you haven't already. So the first part is that the user has to be somebody that the organisation has authorised to use the system. The second part to having authority to view is that it must be for the purpose of healthcare delivery. So as long as the user of the system has been authorised by their organisation and they are viewing the My Health Record for the purpose of healthcare delivery, then they have what is referred to as authority to view. And this is you are protected by the legislation to use the system as you see clinically fit. So it is up to your clinical discretion as healthcare providers to decide when it is appropriate to use My Health Record. And as long as you're authorised by your organisation and you are doing it for the purpose of healthcare delivery, then you are complying with the legislation and you are protected by the legislation to actually view that patient's My Health Record. So this is removing the need for having to ask the patient for their permission or anything like that. That is not part of the process. That is not a requirement. So that's sort of a myth that we see sometimes. Organizations think that they have to incorporate My Health Record into their consent forms or into their new patient forms. That is not the case. You don't need to ask permission from the patient. You simply need to ensure that your users are authorized and that they are accessing it for the purpose of healthcare delivery, and then you're protected by the legislation to use the system ongoingly. The other thing that we like to highlight is authority to upload. So it's the same concept here. It's up to the clinician to determine when they would like to share a document to My Health Record. So documents commonly shared in general practice are shared health summaries and event summaries. Other things that can be uploaded are documents like prescription records when a new medication is prescribed. Other organizations can upload things like, results and hospital discharge summaries and things like that. So uploading can be done at the discretion of the clinician or the author of that document. The only exception to that rule when it comes to uploading is if the patient explicitly says that they do not want that document uploaded. So if they say, please do not share this to My Health Record, or I don't want you to, share that to My Health Record, then you must comply with that request. And that is part of the legislation. That's a requirement, an ongoing participation obligation for using the system is you must comply with patients' request when they say they don't want a document uploaded. However, if a patient does not say that, they don't come out and say, hey, please don't upload this, then this goes back to the clinical discretion of the patient, of the provider, sorry. So if the provider is uploading a document, for example, that they think may have sensitive information, it might be best practice for that clinician to have the conversation with the patient and give the patient the option. Again, this is not part of the requirements for using the system, but we do say it is best practice. So if the clinician is seeing the patient for something that they deem sensitive medically, they might ask the patient, hey, would you like this shared to your My Health Record for your other healthcare providers to view, and give the patient an option in that moment. However, that is not a requirement. So again, it comes back to the clinical discretion of the provider unless the patient states that they don't want that document uploaded. Another minor thing to keep in mind is that certain states and territories might also have specific laws that do apply when it comes to uploading a sensitive information. So if you're not aware of that, might be worth looking into as well. But for the most part, it does come back to the provider's discretion when they are viewing and when they are uploading to the patient's MyHealth record. So moving on to the next consideration there, withholding upload. So this is that same conversation around if a patient says, please don't upload. Well, in a lot of cases, the upload is set up by default. So, for example, with prescription records, this may be set up in your practice where anytime a clinician creates a new script for the patient, then a copy of that prescription is sent to the MyHealth record in the back end. So it's actually not an active upload. So your shared health summary and your event summary, that's an active upload. You have to actually go through the process to create that document and then submit it. However, with some of these other document types, they are set up to be uploaded by default or in the back end of the system. So every software product or every system that is compliant or has MyHealth record built into it must have a way or a mechanism to withhold that upload in this case where the patient says that they don't want that shared to their MyHealth record. So this again comes back to that important conversation around training. If your providers are not sure how to withhold the upload, so if the patient says, please don't upload this, they need to have received training or understand how in their particular software product they can actually stop that document from going up. So if it's a prescription record, let's say, for example, the patient is taking medication for, mental health condition or for a sexually transmitted condition or something like that, and they do not want that shared to their MyHealth record, then they may say, please don't share this. The clinician must know how to withhold that upload. It's often very simple. It's often a tick box in the prescription window that they will untick, and then that will result in that not being uploaded to the patient's record. But it is important to be aware of what that looks like. We have linked on the screen here the clinical software summary sheets, so common clinical softwares that are used in practices. So for example, in general practice, that might be, Medical Director, Best Practice, Genie, ZMed, Communicare. These are all listed on our website if you follow that link to where you can sort of get some screenshots and have a visual representation of what the withholding upload looks in that particular software product. So again, these are additional resources that you might put together as part of the training that is required by clinicians or users within your practice. Thanks, Jade. So another thing to keep in mind when talking about digital health, we know that when it comes to not only using MyHealth record, but also electronic prescribing and secure messaging, many of you will have recently uploaded your NASH certificates. And something that often we hear can sometimes slip through the cracks is having a NASH policy. So Services Australia actually requires that any organisation that uses a NASH certificate to connect to the HI service has a policy around using the NASH certificate. This is a very simple policy. This is something that is not managed by the agency, but it is managed by Services Australia. But we do know that this is something that a lot of practices do find useful to have up their sleeve. So we have linked on the bottom of this screen here the sample policy template that is provided by Services Australia. As you can see on the right-hand side of the screen, it is one page. So it's only got 4 sections in it. It's quite a simple policy, but again, this might come in handy if Services Australia does do any of their own checks or audits around the NASH certificates, ensuring that you have a policy in place for using that NASH certificate appropriately. So that one is there for your convenience to check out later on if you'd like to check that one out. Now, another key consideration on the next slide is just around e-prescribing. So again, many of you are using My Health Record in conjunction with electronic prescribing, or you offer electronic prescribing at your practice. And there are a few useful guides to help you when it comes to ensuring that you're complying with your requirements for using this tool. So we've listed a few of them on the screen there, but the thing that I'll probably just highlight is the first two. So your electronic prescribing active script list privacy framework. So if your organisation hasn't seen that or shared that with the clinicians that are prescribing, that might be useful. And the second one there, the electronic prescription security and access policy. Now, your organisation does not need to create a policy of your own when it comes to using electronic prescribing. However, the Australian Department of Health has put together a security and access policy of their own. So this is the Department of Health security and access policy for electronic prescriptions. So if you're interested in disseminating that amongst the prescribers in your practice, then that might be something that's useful, particularly for anybody that has any privacy concerns or security questions around using electronic prescribing as a digital tool in your practice. It is a really useful tool and something that can save your clinicians a lot of time and improve the services that you're providing to your patients. Electronic prescribing is an enormous convenience to a lot of patients. And if it is implemented appropriately in your practice, can be a really great benefit to both your practice staff and your patients. So certainly if you haven't had access to these policies and frameworks in the past, that might be something that's really useful for you to access. On the next slide, we have a couple of other useful documents for electronic prescribing. Oh, no, we don't. We've got that. Yes. So here we go. Here you've got some really useful training opportunities. So when it comes to using electronic prescribing in your practice, it might be there's a simple solution when it comes to incorporating that in the workflow for clinicians. We know often clinicians who are still paper prescribing are doing so because it's just part of their regular workflow and it's what they know. However, we do have a lot of training opportunities to support clinicians who maybe want to start using electronic prescribing. So we've got some simple videos, some e-learning modules. These can be vendor specific. So if you use a particular software product, you might find that there's actually some really great useful tools and videos and e-learning modules that go into that specific software product that you use at your practice. So it might be very practical. And then there's also more broader training opportunities around other digital health tools. There's cybersecurity training as well, and it's sort of broken up into sector. So again, if you've got a multidisciplinary team and you'd like to share training opportunities to the members of your team, depending on which sort of sector you're in or who you've got that requires training in your organisation, you'll see that there's practice management courses for any of your admin staff. There's nursing courses. There's materials for allied health, any clinicians working particularly in aged care, nursing and midwifery, and also some Indigenous focused content as well for Aboriginal and Torres Strait Islander health, as well as general practitioners. So again, if you would like any specific training, so you've had a look at the resources and you really just want something that's really targeted to your organisation or to the group of providers that you have, please don't hesitate to reach out to us here at the agency, because we can actually offer you and put together some bespoke training. So if you're using a combination of digital health tools, or you've determined that there's some digital health tools in your practice that you would like to start using, such as My Health Record or electronic prescribing, and you've not yet incorporated that, you can certainly reach out to us and we can work out where you're at as a practice and help you with some training to get you going in the right direction. So please don't hesitate to reach out. Please don't hesitate to have a look at the materials that we have available currently. There's a lot of work and energy that goes into these learning modules and webinars and videos, and we've got animations and so forth to help you. And as I said earlier, we've got a whole e-learning module on designing and developing a policy for using My Health Record in your practice. So if that's of interest to you, please don't hesitate to have a look at that e-learning module as well. So I might pause there and get any questions thrown to the panel on the line today. If we've got one in the chat, and again, feel free to pop your hand up as well, and you're more than welcome to unmute and ask any questions. But the first one in the chat is, I just wanted to check, where can we get help to create this policy for our clinic? I might start by throwing out a response, and Jade, feel free to jump in with a response as well. But we do have an e-learning module specifically on creating a policy, so you can have a look at that. There is also guidance on the OEIC website that has a good description of what the policy is about and what needs to be included in there, as well as the template, which can be downloaded from the OEIC website. And we've also got a checklist on our website. So the agency website, if you go to digitalhealth.gov.au, you'll be able to see the policy checklist there as well. What I can do is pop the link in the chat. I can see that Melissa has popped a link to the broader My Health Record website there, which is awesome. Thanks, Melissa. But I might also pop in there a link to the policy information, which also links out to the OEIC website where you can download that template. So certainly there are a lot of resources that are available, and opportunities for sort of support with developing that policy. Jade, anything to add around support with creating that policy?
No, I think you covered most of it, Brianna. I believe the education team also runs a webinar on My Health Record Security and Access Policy as well, so that might be a good one to attend.
Yeah, absolutely. Good one there. So what I might do is I'm actually going to pop a link in the chat to both the policy website that has all the information, as well as that training webinar that we run. It's a 30-minute webinar. It kind of just goes into the policy, breaks it down into bite-sized chunks, and kind of will hopefully point you in the right direction if you're the person in your organisation creating that policy. Looks like we might have a bit of interference with a microphone. I'll just mute that participant. But if someone's got a question, please pop your hand up just so that we don't accidentally keep you muted. If you've got a question, please pop your hand up. We'd love to hear from you. So Chris, sorry, I think
in the chat, sorry, Brianna, there was one more at the end. Who should be responsible for developing or designing the policy if our organisation doesn't have one yet? Don't know if you want to jump in, or otherwise I'm happy to answer that one.
Yeah, happy to leave that one for you. That's awesome.
Yeah, so usually it would be, as we've mentioned, usually there will be an RO or OMO that's been established for the organisation. So often it will be the RO or the OMO that takes carriage of that, but it may also be a practice manager if the practice manager is not already the RO or the OMO. I mean, we often see organisations where the RO might delegate to somebody at the organisation, and you know, I would also expect that staff working at the organisation would probably be consulted in that process as well, given that they are going to be the people using the My Health Record system, and, you know, would probably have some input into the risks that the organisation might face and things like that. So, I mean, there's no strict rule about who should be responsible for developing the policy, but what we tend to see is that it's either the RO, the OMO, or, as I mentioned, the practice manager, if the practice manager is not one of those established people. I think there's a couple of other questions. Brianna, would you mind sharing the link to the NASH policy as well?
Yes, absolutely. The NASH policy link is linked in the slides. I'll just grab that link as well and pop it in the chat. I've popped in there a link to our upcoming webinar, which will delve into actually, designing a policy and give you the opportunity to kind of ask questions around each of the sections of the policy. As well, if you sort of want more of, in-depth support there for that one. And I'll also pop in a link now on the website. While we've got some time, Jade, I might actually screen share and actually show everyone the website, because we keep referring to it, but it might be useful to actually demonstrate the website so that everyone can see sort of what it looks like and the resources that are available, particularly around the policy for My Health Record. So I might just share my screen. Give me a second. And I'll pull the website over. Here we go. So this is our digital health website. So we'll pop the link in here into the chat in just a moment, but it's just digitalhealth.gov.au. You can see this is the My Health Record for providers page. And you can see there's sort of a range of resources. So if you look at the education and training section there, I'll just click on that and it'll take us straight down. There's a range of software summary sheets. So these are the ones that we've sort of talked about earlier. So for example, if we open general practitioners, there's information in here for like a range of software products. And there's also sort of specific sort of other resources as well in there around sort of security, privacy, and access. If we scroll down, you'll see the software summary sheets broken up by software. So for example, just as an example today, let's open best practice. And you can see that there's a range of how-to guides, and these are one-page guides around how to do these sort of specific tasks within My Health Record. And you'll see that withholding documents is also going to be listed in here in all of these software products. What I'll also highlight here is if we go back up to the top and click on obligations, that's going to take you straight down to the button which will open up our participation obligations information for using the system. And this is going to have all of our policy information. So it's broken up into two parts: establishing a security and access policy, and also your ongoing participation obligations. So this is a great deal of sort of useful and relevant information if you're developing a policy for the first time, or perhaps you've got a policy, but you're due to review it. This might be really useful. As Jade mentioned earlier, there's the checklist linked here, which goes through every part of the policy that you need to have so that you can kind of easily check everything off. So again, it's sort of some descriptions up the top, and then you can see the checklist here. So you might want to download this, or you might want to print it out and have it at your fingertips to support you with developing that policy. So really easy to follow there. And then you can also download the template. So we know that, everyone's quite time poor, particularly in general practice. You don't have time to sort of sit there and, design a policy from scratch. So the template can be really useful, and Jade's taking you through a bit of a demo of the template and some of those key features that have been and elements that have been designed in the template for your convenience. So you can click on that, which will take you through to the OAIC website where you can download the template as well. So hopefully this has been sort of useful and pointed you in the right direction if you're going to start with designing a policy or updating a policy. But as I said, feel free to join us for our upcoming webinar. I've popped that link in the chat already. So join us for our upcoming webinar if you'd like sort of a deeper dive into that, and also feel free to reach out to us at the agency. I think our last slide, if I hand back to you, Jade, our last slide has our contact information for anyone who maybe has some questions and you'd like to sort of get in touch with somebody at the agency, we have our help desk that is available for you to contact at any time. So feel free to reach out to us as well here at the agency. There you go. There's a 1-800 line, and there's also help@digitalhealth.gov.au that you can reach out to. So another question has come through. Do you have any metrics on usage? Sorry, Rachel, you might have to just add some further clarification around that question. Usage in regards to My Health Record itself or in regards to the policy. We do have metrics on My Health Record use. So if you're interested in sort of like how many patients use it, how many providers use it, there is stats listed on our website. So I can provide the link to that as well, if that's what you're interested in, Rachel. But I might let you.
Yeah, we are very interested. So we're in a rural, well, regional area in the Darling Downs. And certainly from our perspective, information that we'd expect to find there isn't there. So we've found the usage very, very low in terms of, yeah, medical records, My Health Records, up to date, you know, scripts. It's just, it's not, yeah, popular in our part of the world.
Yeah, certainly. No, that's some good feedback. Thanks, Rachel. There is definitely a great deal of healthcare providers that are connected to My Health Record and uploading results. But again, it does come down to specific areas and whether or not there are providers in your specific area that are uploading. So, for example, there's been a lot of pathology and diagnostic imaging providers across the country that have recently come on board and are sharing results such as, blood tests and scans and things like that. However, there might be some in your region that are still kind of coming on board with uploading those results. Also, the majority of public hospitals across the country are connected, and we're seeing a lot of things like discharge summaries coming from our public hospitals, but there might be some more work in specific areas for those private hospitals to come on board, and that's where we're seeing sort of some more work happening in the private hospital space so we can get more of those discharge summaries from private hospitals. I can share the statistics link in the slide to show you or give you, an opportunity to investigate that a little bit further. And yeah, as I said, if you've got questions about specific providers in your region that you'd like to see uploading more documents or information to My Health Record, then let us know, reach out to us and have a chat to us, because it might be that there is some work actually in the pipeline or there's some things happening already in partnerships with the agency to get more of those providers in your region connected.
Yeah, we'd certainly see that, those that are already leading and making their information digitally available, like Pathology Lab, Sullivan Nicolaides, we never had a problem with them anyway. So the steps to access it through My Health Record are phenomenally greater than just using the existing methods that we have. So it's just really like, what is that tipping point to, really embrace the system? Because I do feel that the people that are not contributing are the ones that we have a problem with anyway, not, the early adopters. We already were able to digitally and through secure messaging access that information. So it sort of seems to be a duplicate rather than finding new information that wasn't already accessible. That's sort of where we're at the moment in our region. Yeah.
Yeah, absolutely. No, that's some really useful feedback. And certainly the whole point of My Health Record is to give you access to information that you wouldn't have otherwise had access to, or you weren't sent directly. So if you're getting it sent directly, then we're not trying to tell you to access My Health Record for that. It's absolutely, there to be a complementary source of information and give you access to things that you didn't already have access to. And that's really the benefit of the system and where we can get more of our providers across the country connected and sharing that information, the better the system is going to be for not only you guys as clinicians and healthcare providers, but also for patients as well. So certainly there is a lot of work underway at the agency to continue that connection piece. There's definitely, I'm not sure if you've been in the news, but there has been a push from government, and there's been a lot of work in the Strengthening Medicare Task Force space to encourage and support the better use of My Health Record. So that's really positive, and I think we'll be seeing some great improvements over the next coming months and years as a result of the priorities of the current government, which is really great to see as well. So hopefully we hear some better stories coming from your region over the coming months and years, and that use continues to kind of go up and improve. But appreciate that feedback, Rachel. I can see Beck has also popped in some feedback there as well, so that's awesome.
Yeah, I don't really want to hog the conversation. It's just, I think the ownership by approaching it this way is putting all the ownership on us as practices, whereas the current systems put the ownership on the organisation who has collected and disseminated the data. So in terms of records, so it's less risky for us to use their systems. It's more risky for us to use your approach, because you're putting all the responsibility back on us. In terms of access. So it's just, it is feedback, you know, like it's why wouldn't I? Or why are others around me not participating? It's because there's an easier way to access the information where the risk is not put on the practice.
Yeah, absolutely. No, thanks, Rachel. We appreciate that feedback, and something that we'll definitely take on board, and you know, is certainly useful to consider when it comes to enhancements to the system and kind of moving forward. Any other questions or comments from the group before we close out? I know we've gone over a couple minutes already, but just before we close the session, is there any final questions? No, I'll take silence as golden. Thanks everyone for your time today. We hope this has been a useful session. We certainly want to see you know, all of you feeling confident and supported with using the system and implementing your policies. There's been a lot of work to enhance the policy template that has been made available to you, and a lot of work here at the agency to try and support the implementation of My Health Record in not only general practice but all sectors across the country. So please don't hesitate to reach out to us and let us know how we can help you better, because that is our priority. And we hope that you have a great afternoon. We hope to see you at another webinar soon. Thanks, everyone.